Understanding ADHD brought to you by Eduspecialneeds.com. ADHD is a brain-based disorder that affects executive function. It will often present itself with difficulties in organizing information, planning, managing thoughts, completing tasks, and with impulsivity. The individual has an inability to control actions and often forgets information. ADHD symptoms continue into adulthood. The possible ADHD presentations exhibit six or more symptoms in two settings for diagnosis. Older teens and adults must exhibit five of the symptoms. According to the DMS/5 diagnostic and the Statistic Disorders Manual, there are three possible presentations for the ADHD. Hyperactive, predominantly inattentive, and impulsive combined. Presented challenges: inattentive, struggles to follow directions, impulsive and distractible, poor attention to detail, appears not to listen, difficulties in organizing information, loses things, takes excessive time completing work or does not complete work, talks excessively in class, lacks mental focus, is forgetful in daily activities, and needs redirection and prompts, and is interested in everything. Trouble with transitions. Hyperactive impulsive. Fidgets with hands and feet, and it has an inability to stay still. Difficulty remaining seated. Excessive extreme restlessness. Difficulties in engaging in activities quietly, as if driven by a motor. Talks excessively. Blurts out answers out of turn. Difficulties in awaiting or taking turns. Interrupts or intrudes upon others. To receive diagnosis, considerations are taken if individual symptoms have been predominant before age 12. Symptoms are present in more than one setting. They interfere with functioning, home, school, and social settings. ADHD is treated through a combination of multimodal treatments: medical, educational, behavioral, and physiological interventions are implemented. This approach of treatments is called multimodal. Skill training and parent training are provided. Behavioral therapy and behavioral management strategies are implemented. Medication can be holistic interventions such as diet and nutrition. Classroom school behavioral intervention and classroom accommodations support the individual in the educational setting. Supports for ADHD in the educational setting: minimizing distraction and establishing rules and procedures. Behavior management strategies and supports are implemented. Behavior modification therapy is critical to ADHD treatment for social, emotional, and educational success. The treatment needs to be tailored to the unique needs of each individual. Counseling services are pivotal in student success. Behavior therapy and behavior modification is critical of ADHD treatment. School-parent collaboration is essential for success of the individual. Behavior management therapy is implemented. Educators are trained in executing behavior therapy crafted to the needs of the individual. It is important to support the child's emotional state with continued encouragement and a positive outlook, always reminding them to do their best, to be respectful, and to have a positive outlook each day. We are here to support them, and they're not alone in their journey. We are here for them. According to the National Center for Health Statistics, during 2020 and 2022, the prevalence of ever diagnosed attention deficit hyperactivity disorder (ADHD) was 11.3% in children ages 5 to 17. Coexisting disorders that live with ADHD. More than two-thirds of individuals with ADHD have at least one or more coexisting disorders. The 2007 National Survey of Children's Health found that 33% of children had a concurrent disorder, 16% had two, and 18% had three or more disorders. Larson, 2011. Possible disorders that live with ADHD: learning disabilities and language disorders, sleep disorders, impulse control personality disorders, anxiety disorders, intellectual disability, substance use disorder, mood disorders, autism spectrum disorder. Children and adolescents with ADHD have common coexisting disorders that present difficulties in areas of learning and affect functioning. Common coexisting disorders: dyslexia and dyscalculia, speech disorders. Treatment of ADHD vary by needs of the individuals and their families. The ADHD is often treated first, as this will improve the ability of the individual to focus and reduce stress, improving attention and ability for the individual to deal with the symptoms. Possible disorders that live with ADHD. Oppositional defiant disorder, ODD. Individual displays a pattern of arguing, losing temper, refusing to follow rules, blames others for mistakes. Individual engaged in behavior intended to upset or annoy others, will display patterns of anger or resent. Mood disorders characteristics: extreme changes in moods, often children seem unhappy, cries frequently, might be irritable. Mood disorders include depression, mania, bipolar disorders with depression. Both genetic and environmental factors may contribute. Bipolar disorder is a severe condition of individuals with ADHD. This involves a period of mania and abnormal energy, constructed by episodes of clinical depression. If left untreated, might lead to challenges in learning, school difficulties, behavioral dysregulation that affects social interactions, substance and drug abuse, suicide. Children with ADHD may also be experiencing anxiety that affects all areas of life. Individuals that suffer with anxiety disorder often worry about a number of things: school, work, social interactions. Keeping close observation for depression and suicide is important. Symptoms could include anger, overly stressed, overwhelmed by emotions, tired, unable to sleep, sleeping too much, withdraw from family and friends, tends to isolate, tense, unable to concentrate, unmotivated, loss of interest in preferred activities. Sleep disorders often coexist with ADHD. Difficulties staying asleep and falling asleep are common. Deprivation of sleep can make ADHD worse. Treatments available in managing ADHD. Behavioral therapy in combination with medication, skills training, and counseling can help manage the symptoms of ADHD. Schools, behavioral interventions, accommodations, and school supports across all the individual's educational environment can support academic, behavioral, and environmental areas. Supportive strategies in regulating emotional self and management of social relationships is important in supporting physiological and social emotional areas. They are pivotal for individuals' success.
Don't forget to visit our resource area. For useful resources on special education topics, visit eduforspecialneeds.com. Disclosure: slides are for informational purposes only. Information does not constitute medical or legal advice. Thank you.